Hi, I'm Dr. Scott Jensen, and I'm at an event today, an event for Tyler Kistner, and I met Renee. Renee's a nurse. Would you just introduce yourself?
Yeah, my name's Renee. I'm a nurse, I'm a mom, I'm a wife, and I love our state, and I just want to do what's right for our state and put people in office who are going to support our families.
So I was here less than 2 minutes, and I met the host, and he said, I've got someone who I want you to meet. I want you to have a conversation with her. And so I came and I met you, Renee. So you're a nurse. Have you changed jobs recently?
I have.
What'd you do?
So I'm a care manager. I advocate for patients and their needs and just trying to support them through whatever they have going on medically.
What had you been doing before?
I was doing clinical work, bedside work, and working directly with patients in clinical settings.
Why the change?
A big change for me was burnout. And really just wanting to make sure I have time with my family and that life-work balance.
Do you think the burnout is something that is literally infecting the entire healthcare profession?
100%.
Have you seen it with nurses, doctors, and lots of other ancillary people?
Yes.
Thanks for having me, Tyler.
I think we could say that we've seen the results of what a fractured supply chain does to the cost of gas. We've seen what a fractured supply chain does to the availability of baby formula. But what we haven't seen yet, we will, mark my words, we're going to see more and more problems with this supply chain of nurses, even physicians, and certainly many other ancillary healthcare workers. But the big crisis is going to be nurses.
It will be.
You folks have been in the trenches, at the front line. You were heroes for a year, and then all of a sudden, you were sort of treated like zeros. And so you decided, I got to get in another area where I got the work-life balance I want.
Yep. Yeah.
Tell me what you think we need to do to get back on the right path.
We need more support from our leaders, top down, bottom up. We need more representation from people who know what's going on at the lowest level of care. And we need people who know how to make the situation better for not only the patient, but for everyone, for staff, for physicians who also have burnout. We need to make it better for pharmacists, for all the support staff from front to back.
Thank you. The only way we make these things better is if we have these conversations. You need to know that what's going to happen is the nursing homes are going to close down. Assisted livings are going to close down. The memory care, we're going to have people that within family units cannot be cared for. There's only so much families can do, and when you get to a certain technical degree of medical need, whether you're talking about bowel and bladder, you're talking about complicated medication regimens, we need absolutely to recognize that we're creating our own crisis, and we're creating it because we're not having these conversations. I don't mean to get too political, but honestly, if our present leaders aren't willing to have the conversation about what's happened from the policies that we did, we're not going to solve this problem. Folks, everyday conversations, this is what we've got to have for the next 5 months. Thank you so much.
Thank you for your time.
Appreciate it.